Good day everyone, my name is Jenford Coquilla together with my group mates, Miss Nina Jimeno and Mr. Oliver Briones. We are the Group 6 reporter for the subject Civic Welfare Training Service 1. Our topic is Chapter 6, Dimension of Development, Health Awareness. In this chapter, we will be discussing some common communicable and non-communicable diseases and their causes, symptoms, and preventions. I will be discussing first some of the common communicable diseases. First, we have dengue. So, dengue fever, as we all know, is caused by mosquitoes. It is a disease caused by one of four closely related virus serotypes of the genus Flavivirus, family Flaviviridae. It is transmitted to humans by the Aedes aegypti mosquitoes that are found in the tropics. The incubation period is from 3 to 15 days. So, dengue is manifested by a sudden onset of high fever with severe headache, myalgia or muscle pain, and arthralgia or joint pain. So, the patient may develop dengue rashes that are characteristically bright red petechiae. Mild cases of dengue where no rash is present can be misdiagnosed as flu or other viral infection. So the best way of prevention is to avoid being bitten by mosquitoes. Some tips to prevent mosquito bites include using mosquito nets and insect repellent, putting screens on doors and windows, refraining from going outdoors during the time of the day when mosquitoes are most active, and removing stagnant water. Okay, so cover water containers and change water in flower vases frequently. So next, communicable disease, we have the malaria. Malaria is a vector-borne infectious disease that is widespread in tropical and subtropical regions, including the Philippines. It is caused by protozoan parasites of the genus Plasmodium and is transmitted by female Anopheles mosquitoes. The parasites multiply within the red blood cells and cause anemia, high fever, chills, nausea, headache, diarrhea, and in severe cases, coma and death. So, malaria can be prevented by avoiding mosquito bites through the use of mosquito nets and insect repellent, spraying insecticides, and draining standing water where mosquitoes lay their eggs. No vaccine is currently available for malaria, so preventive drugs must be taken continuously to reduce the risk of infection. So next, we have cholera. Cholera is an acute intestinal infection caused by ingestion of food or water contaminated with the bacterium Vibrio cholerae. It has a short incubation period lasting from less than 1 day to 5 days. Cholera produces an enterotoxin that causes copious, painless, and watery diarrhea that can quickly lead to severe dehydration and death if treatment is not promptly given. Vomiting also occurs in most patients. So, to reduce the risk of contracting cholera, it is important to follow these precautions. Wash hands with soap and water frequently and thoroughly. Drink safe water only. Eat food that is completely cooked. Avoid raw food, street food, and any food from suspicious sources. And observe proper hygiene and sanitation at all times. So next, we have avian influenza. So avian influenza, also known as bird flu, is an infection caused by avian influenza A viruses found chiefly in birds, but infections can occur in humans. The risk is generally low to most people because the viruses do not usually infect humans. However, confirmed cases of human infection have been reported since 1997. Most cases of avian influenza infection in humans could have resulted from direct contact with infected poultry or contaminated surfaces. H5N1, which is a subtype of influenza A virus, is a particularly deadly strain of bird flu that can infect humans and other mammals. So, symptoms of avian flu in humans include fever, cough, sore throat, and muscle aches. Some people may also experience nausea, vomiting, pneumonia, diarrhea, and other severe and life-threatening complications depending on which virus has caused the infection. So, to prevent infection, consider these precautionary measures. Wash hands or use alcohol-based hand sanitizers to avoid infection of all kinds. Stay away from farms and live animal markets. Cover mouth and nose when coughing or sneezing. Cook chicken thoroughly and do not eat raw eggs. And avoid cross-contamination by not using the same utensils for both the raw meat and other kinds of food. So next we have H1N1. So H1N1, also known as swine flu, is a flu virus that contains two genes found in flu viruses which circulate among pigs and two genes found in flu viruses which circulate among birds. So the H1N1 virus is passed from person to person just like other flu strains. Studies have shown it to cause more severe symptoms in people younger than 25 years of age, while people over 60 years old have some immunity against it. Most cases of flu caused by H1N1 are mild. However, there have been cases of severe complications in people with other medical conditions such as pregnancy, diabetes, heart disease, kidney disease, and asthma. H1N1 is a subtype of the influenza A virus and is the most common form that infects people. Certain strains of H1N1 are endemic in the human population and cause periodic flu outbreaks. So, symptoms of swine flu to humans are similar to those of ordinary flu, like fever, cough, sore throat, runny or stuffy nose, body aches, headaches, chills, and fatigue. Some people may experience vomiting and diarrhea. So the best way to avoid influenza infection is through vaccination. Common side effects of H1N1 vaccines are typical of flu vaccines and includes soreness, redness, minor swelling at the shot side, muscle aches, low-grade fever, and nausea for the flu shot, and runny nose, low-grade fever, vomiting, headache, wheezing, cough, and sore throat for the nasal spray vaccine. So last we have the typhoid fever. So typhoid fever, also known as typhoid, is an acute illness most often caused by the Salmonella typhi bacteria or the Salmonella paratyphi, a related bacterium that usually leads to a less severe infection. So the bacteria are deposited in water or food by a human carrier and are then spread to other people in the area. So typhoid is common worldwide and has received various names such as gastric fever, abdominal typhus, infantile remittent fever, slow fever, nervous fever, or pythogenic fever. So diagnosis of typhoid fever is made when the Salmonella bacteria is detected with a stool culture. So a stool culture is a laboratory test that detects and identifies bacteria that cause infections of the lower digestive tract. Typhoid fever is treated with antibiotics. Approximately 3 to 5% of patients become carriers of the bacteria once infection becomes an acute illness. So, people with typhoid fever usually have a sustained high fever. Chest congestion develops in many patients, and abdominal pain and discomfort are common. Also, the fever becomes constant. Other symptoms include poor appetite, headache, body aches, and lethargy. So, typhoid fever can be prevented by drinking safe water only, improving sanitation, and eating well-cooked food while it is still hot. Washing the hands often and keeping the surroundings clean will help stop the spread of infection. 2 vaccines, one injected and the other given orally, are available. These are recommended especially to people in high-risk areas. So that's all for some of the common communicable diseases, and the following topic will be discussed by Ms. Jimeno.
Good day, everyone. Before I continue this discussion, I would like to introduce myself. I'm Inya Hini. So, if we have communicable diseases, we also have non-communicable diseases.
Non-communicable diseases refers to a group of conditions that are not mainly caused by an acute infection, result in long-term health consequences, and often create a need for long-term treatment and care.
Non-communicable diseases include hypertension. If we talk hypertension, it is part of blood. So,
Blood pressure. This refers to the force by the circulating blood on the walls of the blood vessels. It is one of the body's vital signs. Blood pressure is circulating through arteries, arterioles, capillaries, and veins. It is generally refers to the arterial pressure. Blood pressure consists of two numbers, the systolic pressure and the diastolic pressure. Systolic pressure is when the heart beats, and the diastolic pressure is when the heart relaxes. Systolic pressure is the number above the diastolic pressure. There are kinds of blood pressure. First, the normal blood pressure. It is a blood pressure reading 120 over 80 or lower is considered normal. Next is high blood pressure. A blood pressure reading 140 over 90 or higher is considered a high blood pressure or hypertension. Last is low blood pressure. It is the blood pressure that is low, is also known hypotension.
There are people has hypertension that obviously know cause why their blood pressure is high. It is also called essential hypertension. It is important because blood pressure must be controlled.
The prevention of hypertension. Changing your diet and lifestyle can do much in managing blood pressure. First, quit smoking. Second is limit the intake of alcohol beverage. Next is lost weight if you are overweight. Lastly, exercise and eat well-balanced, nutritious meals that are low in fat, salt, and cholesterol but high in fiber. There are signs and symptoms of hypertension. General signs of blood pressure include headache, dizziness, pounding in the ears, and nosebleed. These symptoms typically do not occur until high blood pressure has reached an advanced and even a possibly life-threatening stage. Next is cardiovascular disease. Cardiovascular disease is high blood pressure increases the risk of coronary artery disease. It is also called atherosclerosis. This is the high blood pressure put added force against the artery wall, so the extra pressure can damage the arteries. These injured or damaged arteries tend to become narrow and hardened by fatty deposits. They block the flow of blood to the heart and cannot deliver enough oxygen to the other parts of the body. Causes of cardiovascular disease are as follows. First, smoking. Smoking cigarette or the cigarette smoker are at a greater risk than pipe and cigar smokers. But all forms of tobacco are forbidden to the detrimental to the heart's health. Next is diabetes. Also overweight. Persons who have an excess body fat are at higher risk than persons of normal weight. Next is diet and high saturated fat and salt. Also family history. Children of parents who develop heart disease before the age of 55 have high risk for developing heart disease. Also lack of exercise and age. Age is risk of heart disease increases over the age of 45 in males and over 55 in females. Cardiovascular disease is also caused of heart attack. Heart attack causes permanent damage to the heart muscles due to loss of blood flow to the heart. Next is stroke. Stroke is the brain requires unobstructed blood flows to function. Very high sustained blood pressure will eventually cause blood vessels to weaken. The prevention of cardiovascular diseases. Here are some tips on how to keep your heart healthy. First, quit smoking. Second is control diabetes, blood pressure, and cholesterol level. Next is exercise regularly. Also, eat a diet that enriched in fiber and low in salt and saturated fat. Next is maintain a healthy weight. And lastly, manage stress. Diabetes, also referred to as diabetes mellitus, describes a group of metabolic diseases in which the person has high blood glucose or blood sugar, either because insulin production is inadequate or the cells in his or her body do not respond properly to insulin or both. The patients of diabetes or with high blood sugar will typically experience frequent urination, excessive thirst, and increased appetite. Diabetes is classed as a metabolism disorder. There are types of diabetes. First is type 1 diabetes. This type is the body does not produce insulin. This is also referred to as insulin-dependent diabetes, juvenile diabetes, or early onset diabetes. People usually develop type 1 diabetes before their 40th year, often in early adulthood or teenage years. Type 1 diabetes is approximately 10% of all diabetes cases are type 1. So, patients with type 1 diabetes will need to take insulin injections for the rest of their life. They must be also ensure proper blood glucose level by carrying out regular blood tests and following a special diet. Next is the type 2 diabetes. This is the body does not produce enough insulin for proper function, or the cells in the body do not react properly to the insulin. Approximately 90% of all cases of diabetes worldwide are this type. Some people may be able to control the type 2 diabetes by losing weight, following a healthy diet, doing plenty of exercise, and monitoring their blood glucose level. However, type 2 diabetes is typically a progressive disease. It gradually gets worse, and the patient will probably end up having to take insulin usually in tablet form. Also, overweight and obese people have a much higher risk of developing type 2 diabetes, compared to those with a healthy body weight.
Good day, this is Oliver Galias Abriones, and in today's video I'm going to discuss about the cancer. And of course, the classification of cancer, signs and symptoms of cancer, and the last one is a prevention of cancer. So, cancer. Cancer is a class of disease characterized by out-of-control cell growth. There are over 100 types of cancers, and each is classified by the type of cell that is initially affected. So more dangerous or malignant tumors form when two things occurs. Number one, a cancerous cell managed to move throughout the body using the blood or lymph systems, destroying healthy tissue in a process called invasions. Number two, a cancerous cell manages to divide and grow, making new blood vessels to feed itself in a process called angiogenesis. So cancer is ultimately the result of cells that grow uncontrollably and do not die. Normal cells in body follow an orderly path of growth, division, and that program cells that is called apoptosis. And when this process breaks down, cancer begins to form. Unlike regular cells, cancer cells do not experience programmatic death, and instead continue to grow and divide. This lead to a mass of abnormal cells and grow out of control. So if you heard the word cancer, what things make you think about the word cancer? So I am very confused about the term or the word cancer. I have made my research. I researched about the cancer, and I found that cancer is connected to our gene, and it is a inherited disease. So in my views and based on my report, I have presented to you that cancer is not really 100% inherited disease. It is our choice to have it. It is how we manage our body. It is how we maintain our health. Smoking, drinking alcoholic, no regular diet is one of the reasons of causing disease like this or cancer. So let's proceed. So cancer is characterized by a cell growth by out of control. So let me use a minimal Bisaya here in my report for you to understand what I'm talking about cancer. So ang cancer, guys, is isa na siya ka mga cell nga mga daot or sa nga gina-produce sa ato ang gene. So kana siya, if that cell continue to invade our body, that will cause a cancer. So not literally or directly caused to, guys, in human body we have a apoptosis or a programmed cell death. So what is apoptosis? Guys, apoptosis, it is a normal physiological process eliminating DNA damages or unwanted cells that causes to make a cancer in our body. And when this process breaks down, cancers begin to form. So guys, imagine that the body of a human seems like a machine of a truck. One mistake of changing its oil, the machine will go broke. And it seems like to our body. It is a simple analogy of this topic, guys, if you will understand what I'm talking about. So for your own understanding, or for you to have a idea about the cancer, I have attached above the pictures as an example for you to figure out this topic, guys. So guys, let's proceed to the next topic, the classification of cancer. First, we have the carcinomas are characterized by cells that cover internal and external parts of the body, such as lung, breast, and colon. As second, we have the sarcomas are characterized by cells that are located in the bone, cartilage, fat, connective tissues, muscles, and other supportive tissues. So third, we have the lymphomas are cancers that begins in the lymph nodes and immune system tissues. Number 4, we have the leukemias are cancers that begins in the bone marrow and often accumulate in the bloodstream. Fifth, we have the adenomas are cancers that arise in the thyroid, pituitary gland, adrenal gland, and other glandular tissues. So in carcinomas, it is pointing its target to lungs, breast, and colons. So for you to understand, I have attached above the picture as you to figure out what is the carcinomas. And the second one, we have the sarcomas. So in sarcomas, above, of course, I have attached above the picture for you to understand. Sarcomas found in bone and the fat and the cartilage, and of course muscles and other supportive tissues. So in this classification of cancer, this type of cancers are most likely very difficult to bear with in medication. So ito yung mga klaseng sakit na cancer na mahirap gamutin, like bone cancer. Dito siya sa sarcomas na belong. So now let's gonna talk about the lymphomas and our number 3 of classification of cancers. So lymphomas, it is a cancer's lymph on an immune system tissues. And for you to understand, I have attached above also the pictures of the example of this lymphomas. Number 4, we have the leukemias are concerns that begins in the bone marrow and often accumulate in the bloodstream. So in leukemia, why are we talking about the bone marrow it begins? It's because, or let me use the minimal Bisaya in my report, sa bone marrow diraa yun nagikan ang mostly sa dugo sa ato ang lawas. So nag-start yun sa bone. So what is leukemia? Leukemia, it is a blood cancers. Like what I have said, it is an abnormal growth of cells to our body or to our blood that cause us a leukemia or a blood cancers to. So let's proceed to the number 5, adenomas. It is a cancers that arrive to our pituitary gland, adrenal glands, and other glandular system. So if we talk about adenomas, it is normally grow to our glandular tissues like our pituitary gland, adrenal glands, as what I have put as an example of this topic above for you to understand. To the next part of my report, the signs and symptoms of cancers. So we have first the skin cancers or melanoma is often marked by a change in white or mold in the skin. So if you talk about the skin cancer, of course, na yun tay mga common signs and symptoms. We have a common signs and symptoms in this disease. One of the best example of this is the ischema, or naapod ka ng magbisaya tagamay ng kagid, or kanang murag bitaw siya kanang murag kalunggo nga magturok-turok sa lawas. That is the common signs and symptoms of this disease. So let's proceed to the next part. We have oral cancers. present white patches inside the mouth or white spots on the tongue. In oral cancer, of course, the common symptoms of this disease is we have the white patches of our tongue. Tongue is dila, guys, ha? Dila na siya, guys. If we talk, so next we have these brain tumors. It is tend to manifest early as they affect important cognitive functions. So if we talk about cognitive functions, guys, it is a consciousness of one's individual of being able to communicate people, being able to recognize, being able to memorize, being able to write or read. If that are gradually losing, it means that you are affected of this diseases, of this brain tumor. So let's proceed to the next topic. Proceed to the pancreas. We have the pancreas cancers. Those mold to produce symptoms until they induce pain by pushing against nearby nerves or interfere with liver function to bring about the yellowing of the skin and eye called jaundice. So this pancreas cancer, it those mold to produce cancers, kumbaga daw tungod kay wala daw ni siya kaayoy, unsa daw wala daw siya sa kaayoy kining mga symptoms nga ginapakita. Those symptoms that only be present of this disease is that yellowing of your skin and yellowing of your eyes. Those are the common symptoms of this pancreas cancer. So as cancer cells use the body energy and interfere with the normal hormone function, it is possible to cause fever, fatigue, excessive sweating, anemia, and unexplained weight loss. However, these symptoms are common in several other maladies as well. For example, cawing and harshness can point to lung or throat cancer as well as several other conditions. When cancer spreads to brain, patient may experience vertigo, headaches, or seizures. So when the cancer start to invade our body, we feel vertigo, seizures, and headaches. So those are the common symptoms of the cancer if it start to invade our body. So next we have the lung cancer may cause cawing and shortness of breath. And of course in lung cancer we actually do experience these common symptoms of disease. The cawing and shortness of breath. This is very difficult to this is very difficult to consider to every. When cancer spreads to brain, patient may experience vertigo, headaches, or seizures. So when the cancer start to invade our body, we feel vertigo, seizures, and headaches. So those are the common symptoms of the cancer if it start to invade our body. So next we have the lung cancer may cause cawing and shortness of breath. And of course in lung cancer we actually do experience these common symptoms of disease. So now we are here in the last part of my report, the prevention of cancer. The following are essential measures to help prevent cancers. So those are the followings that I am going to read are the common or essential measures for you to prevent or to get away from cancer. Of course, first, quit smoking and drinking to significantly lower the risk of several types of cancer, most notably in the lung, throat, mouth, and liver. Stay in shade and protect yourself with a hat and shirt and sunscreen when under the sun to prevent the skin cancer. And number 3, diet is an important part of cancer prevention since what we eat has been linked to the disease. Follow recommended diet that are in low fat and rich in fresh fruits and vegetables and whole grains. So that's it. That's all for today's video. Thank you for watching.